Hi guys. So I wanted to come back. I am one day post-op and continue my little progression on the cervical total disc replacement surgery. I think he said the type that he was putting in something C. I didn't get the full name of it because I was on medication when he told me, but I just remember he said something C, letter C. Anyhow, I have some more information for you guys. I'm actually at home now, not in a hospital room. In my bedroom. I will probably be here at least for the next week, like not planning on going anywhere. They took off the original bandage that they had on my neck and right before I left, and she put this one on there. She had tape, like the whole thing was taped down here, so it was super tight. So it feels a little better, like I can breathe a little bit better now. I have more range of motion, before like it wouldn't let my head move up at all. So that's a plus as far as like how I feel. Yesterday, like day of surgery, my throat was so sore that every time I went to swallow, and it's still a little bit today, but not as bad, but every time I went to swallow, I had to like cringe when I swallowed. It was exactly like having tonsillitis, like where your lymph nodes get all swollen, your throat's just swollen so bad. Some people that had done reviews said it felt like they were being strangled or something was stuck in their throat. And for me, I did not get that at all. I got just a very extremely sore throat. So that was definitely like a plus because I was just super paranoid about it being a lot worse than that. And then like getting anxiety or it triggering my PTSD and going from there. So my throat is better. I feel like the left side, well, they did the incision on the right side, so the left side is sore, but it's not as sore. So I feel like I might be able to eat something, like mashed potatoes or something soft like that, and swallow. It'll be easier for me to swallow on that side per se than the right side. So I'm gonna attempt to do that a little bit later. Yesterday I ate like a little kid-size applesauce and I had like late at night, like 1 a.m. or something, a little chocolate pudding and a little like tapioca pudding because I just been drinking fluids all day. So I had some solid foods in my stomach. Not really solid though, right? Because it's soft food. And then I just drank a ton of fluids. I had cranberry juice, water, a lot of water, a lot of cranberry juice, and my friend Heather brought me Jamba Juice, and I had that. So I was just constantly getting fluids in me as much as I could yesterday, which was good. Okay, so moving on to soreness. I woke up this morning. Yesterday, I said they kept asking me what my pain level was, and I would say it was like between a 7 and a 9. I was definitely medicated though, like every 2 to 4 hours. They were making sure that I had meds. But today was a whole new ball game. I woke up and not only did my throat hurt, like the back of my neck hurt between my shoulder blades, like my shoulders, which I knew that area was gonna hurt, but like a large portion of like my back hurt so bad, and it still hurts right now. Sorry, you guys. Murphy is driving me crazy. He hasn't seen me since Monday, or yesterday, like early morning, so he's all hyper. But anyway, yeah, so what was I talking about? Oh, back. My whole back is aching really, really badly right now. I would have to say like the worst pain of anything right now is between my shoulder blades in the back of my neck. And that makes sense because they, removed the disc, put a new one in, so they did stuff in there. So it's bound to hurt, right? I expect that this is probably I'm gonna have pain, maybe not as excruciating, but I'm gonna have pain probably for the next month. So I brought my X-ray scans. They gave them to my mom. I don't know why, but I guess to show her like what they did. So I thought I would show you guys since it's kind of cool. So that black thing is the titanium that they put in there. Pretty groovy. And I think this one is pretty much the same. I'm definitely going to send this to Kevin and be like, look. So yeah, that is what they did. So I'm hoping and crossing my fingers that this lasts for a really long time and I don't have any adverse reactions to it. Um, my mom, thankfully she was there to help me out, but they had prescribed medication for me, and so she just left to go pick it up. But I have a post-op appointment on the 6th, and then I have of November, and then December 10th, I want to say, I think it is, I have my last post-op appointment, so just 2, and I think they start like physical therapy after that, so that'll be good. So they want me to stop taking my hydrocodone. That's what I took before on a daily basis. And now I'm taking, I'll just give you guys like the generic name since most people know that anyway. Flexerol. So I'm taking that 1 tablet 3 times a day as needed. And that's a muscle relaxer. I'm taking Decadron. And I don't know which, one's a steroid, I think, and one's an antibiotic. So that is one of those two. And then hydromorphone, which is Dilaudid. She gave me 90 of those, and I'm supposed to take one like every 4 hours as needed. And that's for pain. That's like my pain medication. And that is honestly the only thing that worked for me when I was at the hospital. They tried Oxy, and it just made me drowsy. They tried another medication that's like a non-narcotic, like anti-inflammatory, and that helped a little bit. But the Dilaudid was the one that like really, really, really helped with like the breakthrough pain. Like I was still in pain the whole time. I'm still in pain, but it helped bring it down to a level that's like tolerable, you know, to where I'm not like hating life like really bad. So yeah, so my mom went to go pick those up for me. And there's another medication. Oh, Miralax, because you take pain meds. They assume that you have problems going to the bathroom, so they prescribed me that. Yeah, so that is that. And then they sent me home with like the basic summary of your hospitalization. It's this cool little packet, you know, that they give you to go home with. And it just gives you like aftercare instructions. I'm not supposed to take a shower for 72 hours. So what is that? Monday, Tuesday, Wednesday? Tomorrow or Thursday, she said I could take a shower. And she said, take a shower with this. And then when I get out of the shower, put a new dressing on it. And then she said on the 5th day, like this dressing can come off completely. And I won't have to like cover it. You know, I can like the scar will be there and you guys will see it because I'll do a video. And I'm sure it's going to be so big and so ugly, but that's okay because this is going to be amazing. Exercise wise, I can't lift anything over 5 pounds for I think a month or something like that. And then after 4 weeks, she said that I can start exercising, like do more strenuous, like ride my exercise bike, elliptical, anything like that. Right now, they said I can walk and like that is it. And if I feel tired when I'm walking, then just, you know, come home. Don't overdo it or anything like that. And I'm still really like lightheaded and kind of dizzy. And I think that's a combination of like the pain meds, the lack of food in my system, and probably the surgery in general, you know. So, oh, the last thing I wanted to show you guys. So this is the other thing that they're having me wear is a soft collar, and it's got like that dip right here. So that sits right under your chin. Well, I would go like this, you know. But anyways, that is going to help with stability. And that's a main problem that I had last night at the hospital. I could not sleep at all. Every time I'd fall asleep, my head would lean to one side. It would be so tight trying to like bring my head back to like center it. Because there's that weakness, you know, and it needed to be stabilized. So finally I got somebody from the hospital, one of the nurses that was working last night, to go get me one. He found one. It was super awesome. And I just explained to him like my issue, and he's like, okay, you know, I understand. So as soon as I put this on, like I was actually able to like sleep on my side for like an hour, I think. And it helped. I could tell the difference. So I'm going to wear this around the house like pretty much for like a week. And hopefully that'll help a lot. And it'll also help me remind myself not to, you know, be moving my neck around so much and keep it, you know, flat, like straight, and yeah, not make a lot of like head motions and stuff like that. The other thing that's really helpful is they gave me an ice pack that looks like this. You just fill it with ice cubes, and I've been like icing my throat. I did this all last night, and it helped, I think, so much. And then they gave me another ice pack that's in my freezer, but it's just a large rectangular, normal ice pack, and I put that on my back in the middle here, and I like slept. I didn't even sleep really that much last night, but I used that a lot last night. So they would keep coming in and changing out for new ice packs for me, and it really, I think, it made like a big difference. So definitely, if you go through this, ice, and like ice some more, because it is going to feel so good, and I think it's going to take down the inflammation and really help you a lot. Other than that, I am drinking like ice water, like by the cups. Just getting a lot of fluid. I definitely am using hand sanitizer because I have dogs and I don't want any sort of, bacterial like infection or anything like that. And I think that's about it for like day one after post-op, or is that right? See, I can't even talk, you guys. I've been on pain meds for like 2 days. One day post-op. That's it. That's what we'll say. So today is Tuesday, October 24th. I will do another video tomorrow to give you guys an update on how everything's going and just like the process and like where I'm at in the process. So you guys have a good idea. If you have any questions about the surgery in general, or how I'm feeling, or literally anything that has to do with the surgery, just shoot me a comment below, and I will be sure to respond to you and answer any questions that I can. Definitely suggest researching doctors and neurosurgeons if you're thinking about getting a cervical total disc replacement surgery. The surgeon that I had is really well known in Western Washington, and he does like 200 surgeries a year, so he's an expert in his field. And I'm so glad that I did do that instead of just going with like the first doctor that they threw at me. So yeah, I just want to give a shout out to the hospital that I was at in Tacoma, Washington. They did an amazing job. Doctor was awesome. Nurses were awesome. And yeah, it was good. But I will definitely keep you guys updated. I'm going to end rant now because I tend to gab a little bit. And I love you guys, and I will see you tomorrow. Bye.